Good morning. It is Friday, October 15th. Welcome to the Panther News Network. I'm Chaz Nolan.
I'm Zenaria Bowens.
And I'm Jamira Williams.
A fertility doctor is suspected to be a father to an estimate of 200 children is now to face a judge for DNA testing. According to CNN News, the doctor was questioned to have fathered scores of people by secretly exchanging donor sperm for his own, would have a DNA tested after a Dutch court supported a legal challenge by 22 of his potential children. The group were all conceived with the help of a fertility doctor, Jan Carbat, who died in 2017 at the age of 89 and had long been suspected of using his own sperm to impregnate clients, a charge he denied. DNA from Carbat's son, who is still alive, has already been found to hold a relevant biological relationship with 47 people the doctor helped conceive, and a documentary that aired in Netherlands suggested Carbat may have fathered up to 200 children. The court also agreed that it is undisputed that a number of donor children have similarities in appearance to Carbat's. DNA has already been recovered after a court backed a similar challenge in 2017, but it has remained in a safe since then. And the claimants had not previously been allowed to access it because the judge did not feel enough evidence existed at the time allowed for it to be compared. Carbat worked as a fertility doctor in decades for the first hospitals, then at a clinic in Rotterdam, and later at his own clinic in the same city. His clinic shut down in 2009 as significant number of abuses with donor seeds and administrative abuses were discovered, including exceeding the agreed number of children per donor. CNN has contacted Carbat's family for comments.
According to CBS, the United States is in the middle of flu season, and a new report from the Centers for Disease Control and Prevention says this year's flu vaccine appears to be working. The CDC estimates the vaccine has reduced the risk of going to the doctor for flu-related illness by 47% overall this season. The effectiveness is even higher among children between the ages of 6 months and 17 years old, with the vaccine reducing doctors' visits by 61%. Numbers can change between now and at the end of the season. The important thing is the vaccine is providing some protection against the viruses that are circulating, Dr. Brendan Flammery of the CDC told CBS News. The CDC says the predominant strain of the virus so far this season is H1N1 in most of the country, although a strain called H3N2 is predominant in the Southeast. Even though flu activity is lower than it was at this point last year, the illness is still responsible for a minimum of 155,000 hospitalizations and a maximum of 16,000 deaths nationwide. That puts it on track to be a season with a substantial number of deaths that's likely to rise, Flannery said. We also see 28 pediatric deaths so far this season. That's also unfortunately likely to rise. Last season, the CDC estimated 80,000 Americans died of the flu and its complications. That was the deadliest toll in 40 years. Health officials said that after a slow start, flu activity has been picking up in the past few weeks and is now the highest it's been all season. Experts stress if you haven't received a flu shot yet, there is still time to get one.
Trump to declare emergency over Mexico border wall. U.S. President Donald Trump is to declare a national emergency to fund his planned border wall with Mexico. Building a border wall was a key campaign pledge of Mr. Trump's campaign. Declaring a national emergency will give Mr. Trump access to billions of dollars for his project. The rarely used move would enable Mr. Trump to bypass Congress, which has refused to approve the money needed. Several Republicans also voiced concern at the plan. The president agreed on Thursday to sign a spending bill that does not include finance for the wall. Disagreement over the issue led to a 35-day government shutdown earlier this year, the longest in the U.S. history. The spending bill must be signed on Friday to avert another shutdown. Citing unnamed White House officials, U.S. media outlets reported that the president would sign the Emergencies Act at the same time. The National Emergency Act is intended for times of a national crisis. Mr. Trump has claimed that there is a migration crisis at the nation's southern border, a claim strongly refuted by migration experts. The largest number of illegal immigrants settling in the U.S. each year is those who stay in the country after their visas expire. Declaring a national emergency would give President access to special powers that effectively allow him to bypass the usual political process, and he would be able to divert money from existing military or disaster relief budgets to pay for the wall. Speaker of the House Nancy Pelosi and Senate Democrat leader Chuck Schumer issued a strongly worded joint statement condemning the move. Declaring a national emergency would be a lawless act and a gross abuse of power of the presidency, and despite attempt to distract from the fact that President Trump broke his core promise to have Mexico pay for the wall, read the statement. He couldn't convince Mexico or the American people, their elected representatives, to pay for his ineffective and expensive wall. So now he's trying to end run around Congress in a desperate attempt to put taxpayers on book for it. Ms. Pelosi had already suggested that Democrats would mount a legal challenge. And we'll be back with a regional and PV News commercial break.
Traditions are not made overnight. They are created through a legacy of excellence and a commitment to something much greater. For more than 135 years, Prairie View A&M University has provided students with a strong academic foundation, a unique college experience, and the opportunity to make their mark on the world. This is a place where friendships are formed, discoveries are made, and dreams are realized. This is Prairie View A&M University, our tradition, your opportunity.
Prairie View A&M University is about the students. Students don't just come here for the education. They come for the faculty, for the creativity, the camaraderie, an excellent standard of living, and the school spirit. They come here to gain something profound and to give something back. Students come for the tradition of excellence. This is Prairie View A&M University. Our tradition, your opportunity.
Welcome back. Today is National Don't Eat Alone Day, so be sure to grab a dinner with someone you love. Are you ladies participating in this event?
Yes, I most definitely am. I will be going to Chipotle today at 1 o'clock p.m. to enjoy this National Don't Eat Alone Day with one of my friends, because it's just Chipotle is just something that should be shared regardless on any day. So yeah, I'm going to participate. Are y'all?
For sure. I'm always down to eat, so.
I'm not sure what I'm going to be eating, but I know I'm going to spend it with someone.
For sure.
Oh, that's nice. Cute. Okay. Well, you guys, this is all the time that we have for today. Thank you for tuning in to the Panther News Network. And I'm Chaz Nolan.
I'm Jameera Williams.
And I'm Zaneria Bowen.
And we will see you on Monday.